Hello, how are you? Today I'm going to talk to you about a topic that is very important and, unfortunately, very common these days. It's about people who are constantly extremely tired. These are people who are feeling more and more exhausted in their daily lives and are starting to think that's normal. They think it has to do with age, with stress, with anxiety, or with 1 or 2 or 3 bad nights of sleep, and they believe it's fine, that it's just part of life, and this is happening more and more often because a colleague, a friend, a cousin, or sometimes even their partner is also feeling very tired. But this isn't normal. And unfortunately, nowadays we are seeing a correlation between many people who are extremely tired and a very serious health problem, which is a liver problem. Today, I'm going to explain to you why this happens and why it's so serious. You need to watch this video, stay until the end, you won't want to miss it. Before we start, I want to ask you if you've been feeling tired in your daily life, at home, at work. Has your level of fatigue increased recently? How long have you been feeling tired? Has this tiredness been increasing over the past few weeks, months, or even years? Is it a tiredness that doesn't go away even after sleeping or resting? Tell me in the comments. And how old are you? I would love to see your comment. The liver is a very complex organ. It's an organ we really need to pay attention to. It's truly the energy powerhouse of our body. It performs more than 500 different functions, from processing nutrients, filtering toxins, regulating hormones, storing energy, to being part of the digestive process. It's a real conductor. But unlike the stomach or the kidneys, it doesn't have pain nerve endings. This is a very important point for us to discuss here in the video. So when you have inflammation or even fibrosis in the liver, you don't feel pain. You don't feel that sharp pain in your liver. So the signs end up being very subtle, almost easy to overlook, and they need to be watched closely because sometimes it's already starting to fail quietly in the background. And by the time you begin to notice those bigger signs and symptoms, it might already be moving into a much more complex stage, a larger, more serious problem that unfortunately can become much harder to reverse. The first sign you need to pay attention to, and never let anyone downplay this for you because unfortunately it's common, is persistent chronic fatigue. When the liver is overloaded, it can't metabolize toxins and nutrients efficiently, and these substances end up circulating in your bloodstream and increasing inflammation in your body. So this leads to fatigue, a constant tiredness. You won't have the energy to do even the small things in your daily life. Many people think this is just stress. They think it's just a lack of sleep, but it could be your liver crying out for help. And it might sound like a joke, but sometimes the person has just woken up. They don't have the energy to make lunch. They don't have the energy to go for a walk. They don't have the energy to do these everyday activities. It's an exhaustion. Sometimes the person can't even walk from the bed to the living room. It's truly a terrible fatigue. Have you ever felt this kind of exhaustion? Another sign your liver might give you when it's suffering is a more bloated belly. This abdominal swelling can be a sign of ascites, which is the accumulation of fluid in the abdomen. And this happens because when the liver is sick, it decreases the production of albumin, which is an essential protein to keep fluids inside the blood vessels. There is a leakage into the abdominal cavity, and this occurs in more advanced cases. There's another interesting point because many people who have fatty liver and these problems related to fibrosis, hepatic steatosis, also have high insulin levels. So often we don't know what came first, the chicken or the egg, right? I'm saying this in a more playful way so we can understand it better. So many people who have uncontrolled diabetes, insulin resistance, may have had this fatty liver, this hepatic steatosis for a long time, and this can cause an increase in fat in this central visceral abdominal region, which can be a non-specific sign. So, if you've been noticing an increase in fat in this area, it could also be indicating that you might have increased fat in your liver, and it's worth investigating. A classic sign that everyone already knows for a long time, even our grandmothers knew this. It's the yellowing of the skin and eyes, which we commonly call jaundice. In more medical terms, it's called icterus, which happens when the liver can't process bilirubin, a pigment produced when red blood cells break down. This pigment accumulates in the blood and causes the skin and eyes to turn yellow. In other words, when it can't process it, it's a sign that the liver is already having serious trouble functioning. This is a sign of a more advanced liver problem and should be investigated as quickly as possible. When this happens, this buildup of bilirubin will cause itching. So itching is also a sign of a liver problem. That's because the liver also produces and eliminates bile salts. So when it can't do this properly, these salts accumulate in the blood and end up irritating the skin, causing this itching, dark spots, redness on the palms of the hands, and even dilated small blood vessels on the face. I don't know if you've ever seen someone like that, and often people think it's just a skin problem, but the real issue is with the liver. It's worth looking into as well. Another sign is loss of appetite and nausea, because since the liver is closely related to digestion, it alters bile production and the regulation of hormones related to hunger and satiety. So, the person feels frequent nausea, less desire to eat, may lose weight because they have no appetite. So all of this can be interconnected. And this weight loss can sometimes be hard to notice because the person may be losing weight, but their abdomen might be enlarged. So sometimes it's difficult to quantify this. That's why, in some cases, it's already a good idea to have medical and nutritional follow-up if the person has been having liver problems in order to properly monitor their weight and their measurements and to check exactly how things are going. In a more advanced stage, the person may experience memory confusion and mental problems, which is called hepatic encephalopathy, because the diseased liver cannot properly filter ammonia, which is a toxic substance that comes from the digestion of proteins. So this ammonia reaches the brain and causes memory lapses, difficulty concentrating, and even disorientation. This is a very sad and complex condition that deeply affects those who experience it, and it should be treated as quickly and carefully as possible. The person will probably need to be hospitalized for treatment, and afterwards, their diet will need to be very carefully adjusted to prevent new crises. So it's extremely important to monitor the person if they've already had this to avoid relapses. What can cause all of this? How can we prevent the liver from reaching such a delicate point, to prevent it from reaching such severe symptoms? We already know that excess sugar, ultra-processed sugar, soft drinks can lead to hepatic steatosis. In the past, when we talked about hepatic steatosis, we thought of alcohol as the cause. In the past, the main cause of hepatic steatosis was alcoholism. Nowadays, we already know that's not the case. Of course, alcoholism is still a serious cause of hepatic steatosis, cirrhosis, and liver problems, but more and more, this unbalanced diet has been causing steatosis, and we see cases of fibrosis and cirrhosis in people who have never drunk alcohol. This is a very important point to mention. The abusive use of medications as well, especially paracetamol, anti-inflammatories, and anabolic steroids, causes this in increasingly younger people. Undiagnosed hepatitis problems can end up being silent and may cause this kind of damage for years in people who, if they had been diagnosed earlier, could have received treatment and not reached such a sad point. So it's super important to protect our liver. I have an entire playlist here about liver problems, foods, and the liver, and I'll leave both of them down below in the description to help you out, okay? Let me know if you are aware of these signs that your liver is asking for help, if you've ever had any liver problems, or if you managed to get better. I would love to see your comment. Remember to like the video, because that really helps me, and share this video with anyone you think will enjoy it or who needs it. Let's work together to expand this chain of good, because that's what I want here with the channel. See you next time. Bye.